Spectrum Health has a dedicated health and wellness center for women that focuses on women's issues. And one of those issues that may affect many people is abnormal uterine bleeding. Today, Dr. Jessica Lally is joining us to give us more insight on what that means and what treatments they offer at the Women's Health and Wellness Center. Hi, Dr. Lally. How are you?
Hi, I'm great. Thanks for having me, Jordan.
Yeah, thank you so much for joining us. You know, there are so many women that don't go to the doctor when they need to because, one, they're taking care of so many other people that they forget to take care of themselves, and health is one of those reasons that they should be going to the doctor and asking these questions, but a lot of times they're too embarrassed and they think that something that they're saying is probably abnormal, but you're helping with that.
Yeah, absolutely. You know, we want women to reach out that have concerns with heavy periods. It's something that maybe they're embarrassed to talk about. They don't talk to their friends about it a lot. And they may have been told in the past that things are normal. And we have a lot of treatments and options to help them. So what is abnormal or heavy periods? That can mean anything from periods lasting more than 7 to 8 days is considered to be abnormal. If you are swelling through protection more than every hour, if you're passing large clots, or if you're sort of unable to leave the house for days at a time during your cycle, that is not normal. And there are many things that we have to offer to help you.
Yeah, so what causes this issue? And is there a predominant age group that should be aware of this? Are these younger girls who are just coming onto their menstrual cycle, or are this older women who are really experiencing something like this?
So sometimes we can see this in younger girls, and that tends to be more hormone related. As they're beginning to mature, their ovaries are just starting to function, and sometimes that can lead to irregular cycles or sometimes heavier cycles. In more reproductive age women in their 30s and 40s, we start to see still sometimes hormonal issues that can occur, but also sometimes we'll see abnormal growths in the uterus. We call structural issues, where there may be a small little polyp inside the uterus, or there may be fibroids, which are little tumors that can grow in the uterus. Sometimes they're small, sometimes they can grow very large. And those can be other issues that can cause heavy periods.
Yeah, doctor, so if women are watching at home and they're thinking, okay, this possibly could be me, I have experienced something like this, but I'm not quite sure, how can they differentiate between, yes, I need to go in, I need to talk to someone right away, or this is probably normal, what I'm experiencing?
Well, one condition or one situation, if you are postmenopausal, where your periods have completely stopped and then you start bleeding again, any amount of bleeding after menopause is abnormal, and that really needs to be evaluated right away. In other situations, if you have a long history of heavy periods, passing clots, maybe prolonged periods lasting more than 7 or 8 days at a time, you can become anemic from that, which is like a situation where you have low iron, and that can lead to fatigue and just low energy, and that can lead to other health conditions as well. So that's another reason to come in to be evaluated for that. And really any situation where you feel like your periods are impacting your quality of life and impacting the things that you want to do and are able to do, that's a situation where you should feel compelled and empowered to come in and talk about it.
Yeah, and treatment options are available, and that's why the Spectrum Health Women's Health and Wellness Center is there to help in so many different ways. Can you talk to me a little bit about the center?
Yeah, we have kind of a multidisciplinary center where we have physicians and providers with different areas of expertise surrounding women's health. So we really can provide sort of a holistic approach. So we have providers that are specialized in dealing with hormone issues, and we have providers that, like myself, that offer more surgical options for some of these conditions. And then we have other preventative health for women as well, including things like mammography and bone health and preventive cardiology. One of the really nice things, if a woman's coming in with a new problem, such as heavy periods that they want to talk about, is we do offer longer appointment times. And one of the things that we really pride ourselves on is really listening to our patients. And we want you to feel heard. And we want to give you different options and kind of tailored treatment options to you.
Yeah, and doctor, if people want to get a hold of you, what do they need to do?
They can check out our website or call directly. We'll take direct referrals. All you have to do is call, and we have health coordinators that can help get you to the right provider so that we can help you live a better life.
Yeah, and we just had that information right on our screen. We'll also have it on our website. The number is 616-267-8520. Thank you so much for your time today. We appreciate it.
Thank you.
Yeah.